Okay. Hi, everybody. We're just still getting set up, so I'm going to say hi. We have a really good literary selection to start with today. I'm excited about it. We're going to just give another couple of minutes to let people arrive. We have about 2 more minutes to go, so just going to chill. Oh, hey, Helen! So good to see you. I think you're going to already have read this piece from today. And actually, I'm going to give a shout out to Emma because Emma, if you're watching, I'm pretty sure that you are the person who first recommended this to me many years ago. And I read this essay that I'm going to read today, the excerpt first, and then read the whole book and loved it tremendously. So thank you for that recommendation. You are drinking astragalus chai right now. That is so awesome. I'm so glad to hear it. I really have been neglecting the tea part of tea and teaching until today. I don't know if you guys, there's not really, you can't see it anymore, but I made a big, Helen, you're going to laugh at me. I made a really big pot of schizandra, hawthorn, and hibiscus. and it was so good. It's so sour, and the color was just amazing. I should have saved enough of it that you guys could see the color, but I've consumed all but the very. Oh, I can pour it. I'm gonna pour it into this. I've solved the problem, so you can see it. It looks just like the crazy fruit punch that I used to drink as a child. In the 80s, like really terrible fruit punch, but that's like all hibiscus right there. Just doing that. It's pretty awesome. Okay, so it's 7 o'clock, so I'm gonna go ahead and get started. Welcome, everybody. I'm so pleased that you're here. We've made it through the first month, through the foundational month of this series, and we have 2 months to go. I'm feeling pretty good. Still really looking forward to these sessions with you each week. And today we're going to talk about kind of a couple of intertwined issues that I think are really important for those of us who are working with herbs for ourselves and sharing them with friends and family, or, just folk medicine kind of stuff, and then also very important for fellow practitioners. So I'm going to work to weave this in a way that's going to be applicable to everybody. And I think there's going to be something here for you, whichever part, or if, all of these parts that you engage with. And we're going to be talking about placebo, the placebo effect, magic, and ethics. And in order to frame this a little bit, I want to read an excerpt from this absolutely terrific book called The Empathy Exams by Leslie Jamison. And it's not immediately clear, as sometimes happens with my selections, the precise relationship between these things, but I'll be interested to hear what jumps out at you after hearing this. So we're going to read just a couple of pages from the title essay from this book. I do recommend reading the whole essay and, in fact, reading the book as well. So the author is describing her she's got a side hustle, as she's working as a writer, and she's, her artistic life. And her side hustle is that she does medical acting. So she gets paid, like something close to minimum wage to learn an identity of a standardized patient, and then pretend to be this person for medical students who are doing, parts of their training, or who are taking a test. And the standardized patient exams are about trying to teach medical students to not only ask the right diagnostic questions and cover all the bases they need to cover, but they're also graded on their empathy. And that is one of the sort of the frame for this essay. So she's describing the character that she has to play as a standardized patient. One of the hardest parts of playing Stephanie Phillips is nailing her affect, la belle indifférence, a manner defined as the air of unconcern displayed by some patients toward their physical symptoms. It's a common sign of conversion disorder, a front of indifference hiding, quote, physical symptoms that may relieve anxiety and result in secondary gains in the form of sympathy and attention given by others. La belle indifférence. Outsourcing emotional content to physical expression is a way of inviting empathy without asking for it. In this way, encounters with Stephanie present a sort of empathy limit case. A clinician must excavate a sadness the patient hasn't identified, must imagine a pain Stephanie can't fully experience herself. For other cases, we're supposed to wear our anguish more openly, like a terrible, seething garment. My first time playing Appendicitis Angela, I'm told I manage, quote, just the right amount of pain. I'm moaning in a fetal position and apparently doing it right. The doctors know how to respond. I'm sorry to hear you are experiencing an excruciating pain in your abdomen, one says. It must be uncomfortable. Part of me has always craved a pain so visible, so irrefutable and physically inescapable that everyone would have to notice. But my sadness about my abortion was never a convulsion. There was never a scene, no frothing at the mouth. I was almost relieved 3 days after the procedure when I started to hurt. It was worst at night, the cramping, but at least I knew what I felt. I wouldn't have to figure out how to explain. Like Stephanie, who didn't talk about her grief because her seizures were already pronouncing it, slantwise, in a private language, but still granting it substance and choreography. So, in a way, I'd love to hear what you sense, especially we have some people in medical training who are here tonight. I'd love to hear what stands out to you from this. And because of the delay and because of the number of people who are present, I'm not going to take long pauses. I'm going to try to stay on the brisk track for this class. So please share your thoughts as I continue. I think the reason that I chose this is because we have the sense that there is something about the encounter, the healing encounter, whether it is, somebody you love just giving you a kiss after you skin your knee as a little kid, or your friend, giving you some Advil from her purse because you have a headache at the theater or something. Or you're sitting down actually, with a surgeon in a consultation before you decide to have a procedure, or sitting across from an herbalist or an acupuncturist, being listened to and having somebody observe and understand what's happening with you before making recommendations and trying to help. That there is something in that encounter that is part of the healing. And depending on the person, whatever that is gets called different stuff. Sometimes that seems to be relegated to this idea of a placebo. And we're going to talk more deeply about that. Sometimes it's experienced as something almost magical, like the magic of the relief that you can feel after telling your story to someone. Or, as a client of mine has remarked a few months ago, I really just feel better after talking to you, after telling you about this. That seems to really help more than anything. Like she was really surprised at that. Um, and this wraps in with the questions about ethics, because when we are trying to evaluate the benefits of something that we're doing, if the stated goal is not you're going to talk about what's wrong and the act of talking about it is going to make you feel better, if that's not the agreement we're making, then there's an ethical question about, well, how do we evaluate the thing we say we're doing here? In the case of my work and in the case of this class, we're talking about herbal medicine. How do we evaluate that apart from this intrinsically comforting, helpful, and profound encounter? And how do we label that, and how do we separate this all out? Helen says, I'm thinking of how much pain and depth so many of us carry, what is actually visible from the outside, and how others value that pain depending on its visibility. Yes. Yeah, you could write a whole essay on that, Helen. Hi, Kayla. It's so good to see you. So there's a part of me when this placebo question comes up that I wrote about. This happens to me all the time. Some of you who are watching have probably said this to me, actually. One of the things that happens almost all the time when I start working with a new client, after they start taking their herbs, they begin to improve. Things start to get better. Sometimes it's very dramatic. Sometimes it's very subtle. Sometimes it's somewhere in between. And in some cases, it actually takes quite a long time for progress to be noticeable. And then I have cases of people who don't seem to benefit. That does happen as well. But most of the time, within a week or two of starting herbs, people are feeling better and they're noticing it, and it's obvious. And inevitably, what happens is my client says to me, yeah, my bowel movements are a lot better, and I'm not really having that sleeplessness anymore. Like, I think I slept pretty well the last 3 or 4 nights. I didn't even I didn't even have to, I don't know, do blankety blank bedtime ritual, or and a lot of times it's subtle enough that I have to ask them some questions or reflect back. Well, when we first talked, you told me that your stomach hurt every time that you ate something. Is it still hurting after everything you eat, or just sometimes? And then they'll be like, oh yeah, I think if I eat blank or blank, it still bothers me. But I felt great after breakfast today. And then once they've sort of fully taken in that things are feeling better, the next thing to come out of their mouth is usually, yeah, so I don't know if these herbs are working or if it's just a placebo. And it's so fascinating to me because, I'm not a physician, so I don't really know. But I was in a relationship with a physician for many years, for like 5 years. And I don't remember him ever once telling me that his patients, or that the patients that he observed, that they would say, well, I think this antibiotic is working, but maybe it's just a placebo. Or I think that, I don't think that this is how people feel about pharmaceuticals. I think that there is a way that, because it's not widely done in our culture, we have some fear, some lingering fear and distrust about herbal medicine, and we don't really expect it to work, and we actually kind of might expect it to possibly hurt us. So the other thing that happens is that while my clients usually have some doubts as to whether the herbs are helping or if they're experiencing a placebo effect, they also tend to blame the herbs for anything that goes wrong. So, if the classic example that my teacher would tell is like, somebody goes and they eat like some kind of crazy fast food meal and they feel unwell and they think, well, gosh, I don't know if these herbs are really working or agreeing with me. And I've had cases very similar to that where people have told me this, and then I've asked them like, well, what did you do that day? Or like, what? Well, I did go out drinking the night before, or something, it'll be something like that. So all this is to say that the placebo effect is real. And our bodies have an inherent capacity to restore themselves, to right the ship when things are not going well. There are so many interlocking systems that are designed to get us back to how we should be, or to help us feel better or overcome illness and issues. And so we really have to be aware that this is true, and it's always possible that we could be experiencing a placebo effect rather than a physical effect of something that we're taking. Most likely, however, whatever you're doing physically is going to be intersecting with the non-physical parts of the healing encounters and experiences. And to my mind, this is an ideal situation, because while it would be highly unethical for me to tell somebody to like think in my head, well, this isn't really an effective therapy, but if I pretend that it's effective and I convince this person that it's effective, then the placebo effect is going to kick in, 50% of the time, and they have a good chance that they might get better actually without any side effects or risks if I just convince them that this is good. This is part of the reason why, and this is my YouTube channel and this is my class, so I'm allowed to say these things. These are my opinions. I'm open to being proven wrong, but this is why I don't personally work with flower essences and homeopathy in my practice. I personally have not been convinced by the existing evidence that these things are better than a placebo. And I'm open to having my mind changed, as I have told you. But because I have reviewed the evidence, and I don't believe that it would be anything different than me giving someone a sugar pill to work with homeopathics or flower essences, I don't go there. The only exception is if a client comes to me and we're working with herbs and they're personally very interested in flower essences, they really want to do it. And I explain to them that, well, if you want to think about it as a part of your relationship with the plant, okay, and here's what you might choose, or here's how you could make your own, or this kind of thing. So we do have an ethical responsibility. And you do need to look for practitioners who are thinking about this to do more than just offer the context of care. It is powerful to have someone listen to your story and to empathize with you. And another thing that I think is really great in this essay that Leslie Jamison writes, she has a heart condition, and she's talking about an ablation that she had done on her heart, and about her surgeon saying to her at one point, Well, we could continue the ablation. We could go in and do the procedure again. But if we take much more tissue than we have now, you could end up needing a pacemaker. And on someone with your body type, it would be a visible box coming out of the center of your chest. And she writes about how his manner was so cool and comfortable, unshaken, and that he wasn't deeply empathizing in the pit and in the mud, like with her body image concerns of like, oh gosh, if I had a box in my chest, how weird that would be. That there was enough empathy that he anticipated what her question might be about whether this would be visible or how she'd be aware of it, but that he was standing in a place of being cool and calm and confident, balancing the fear and uncertainty that she felt. And so that can be valuable from a practitioner too. The sense of somebody understands what's going on here. Somebody has their feet on the ground. Somebody cares about me and they're not freaked out by what's happening. And a lot of times this, how that plays into placebo or not, I'm not certain. But a lot of times I feel that that is what I have to offer my clients because, and this will be true for those of you who are complementary practitioners as well, a lot of times if people have gone to provider after provider and no one can offer an explanation for what's happening, and then you come to a new paradigm like Chinese medicine, and it can offer an explanation. I was talking about this today with a friend. I had a strange symptom. I was describing a strange symptom I've experienced in the past with urinary tract infections, where whenever I've had a urinary tract infection, as I urinate, you guys, I love you. I'm telling you this like so private. If I have a urinary tract infection and I'm urinating, my fingertips get really cold. They like immediately are freezing, like just while I'm peeing, and then it's over. And then usually like within a couple hours of that, I start running a fever, and it's, quick path to antibiotics at that point. And in Western medicine, I don't think there's an explanation for that in Western medicine. My friend and I were talking and I was like, yeah, I think in Western medicine, the explanation is like, lady, that's not happening to you. You're crazy. Like that doesn't exist. It's not a thing. And in Chinese medicine, it's clear what's happening. There's heat and damp stagnating in the lower burner, and it's obstructing the flow of qi, and the qi is constricted, and so therefore, like, you're getting this like lack of circulation at the extremities. And so that kind of experience of going from not having an explanation to having one, even if it's from an alternative paradigm, can be so comforting for people. And I think that just feeling that you're held and you're supported and things are going well, that has to facilitate some amount of what we would call a placebo effect. So I'm going to throw a little wrench into the mix now. What is the difference, do you think, between the placebo effect and magic? You can define the term magic any way you like, colloquially, or are they the same? Like, what do you feel about the relationship between placebo and magic? And here I said I wasn't going to wait super long, but we're doing really well for time, actually, so I don't mind waiting a minute for you guys. Okay, you don't seem to have any thoughts. You're just going to see me like sitting here like this. So my sense is that the definition of magic that I like the best is that human beings describe anything that we cannot explain in terms of our technology or our psychology or our science as magic. Oh, Helen, I like this. Helen says, I think I could see the placebo effect as a sort of magic coming from within ourselves. And I think magic would be more broad, also including things coming from outside us. That's very interesting. So it's almost like you see the placebo effect as a kind of endogenous magic, and other magic as like exogenous forces. Very interesting. Um, I kind of take this view, I like this, but I also kind of take this view of like, similar to I think what you're saying, Helen, of like maybe magic is the overarching category and placebo is one kind of magic, in the sense that if magic is just the word, the catch-all that we use for anything that happens in a way that we can't understand, um, it's something that can't be explained by our current understandings of science or technology, or even just our personal understandings of these things. If someone else understands, there are plenty of people who understand how this computer in front of me works. It's not an unknowable thing. However, my experience of the computer is much closer to magic than science because I don't really understand it. So the same thing with the placebo is that we don't actually know exactly what it is that makes it happen. We sense that there's something inside, something outside. There's a lot of really interesting research now in the field of narrative medicine, talking about the way that telling our stories contributes to physical healing. There is understanding about, the way that the ritual encounter with a doctor, or, a healer type person, that kind of encounter seems to play a role. In many people of faith, prayer and religious ritual and traditions can play a role, but we don't totally understand it, so we kind of experience it as magic. And when you are trying to do a scientific study, or when you're trying to make an ethical decision as a practitioner and a provider about whether what you're offering to a person is something that you should feel good about offering them, then you kind of don't want just random unintelligible magic messing up your sense of like what you know and what you don't know. And so that is the reason why this question of placebo is important. So here's how I work with it. And there are probably other ways, but I'd love to hear if any of you have thoughts on this. And here's how I work with it. When a client and I first start working together, and I think if you are on the side of you're not ever really interested in being a practitioner, but you are interested in doing this work for yourself, you can demand that your healthcare providers of all kinds do this. I demand this of all of my providers. When I decide to work with a client, I give them an assessment of what I think is going to be necessary in order to see change in a condition. This breaks down when I meet with someone who has a challenge that I've never worked with before. So this does really rely on clinical experience. So when you're really new, you have to just sort of do your best and admit to your person that this is a new developing part of your experience, and that your best guess, is that this is how long it will take. So I give people a sense of what the minimum effective dose of our work together will be. And I base that assumption on, the facts in front of me. And myself, I don't think it's absolutely true that it can take the body some time to heal from conditions that you've been, contributing to for most of your life or all of your life. But in my opinion, I haven't yet seen a situation where after 3 months, we couldn't get any amount of improvement, but then in the next 3 months we did, or in the next year we would. I think that 3 months is the outside limit of how long this should be. If you're in a place where you're working with an herbalist, there obviously are, I'm not speaking about all medical conditions, but for me, in the kinds of conditions that I deal with, that is the maximum. So if you have sort of generalized challenges, reproductive issues, this kind of thing, stress-related issues. If you're going to a provider for 6 months, 9 months, 2 years, and they keep saying to you again and again, well, everybody's different, your energy is changing, but it's going to take time for your physical body to change. I call BS on that. I honestly do. I think if you haven't seen results in 3 months, there are not a lot of, unless you are really just not motivated and you're not actually doing the things they're telling you to do, or they haven't given you enough support to make the changes you need to make. You've been misdiagnosed, or that it's not the right kind of help. You need to move on. You need to get something else supporting you. So I think the first pillar of ethical practice is identifying the minimum effective dose and then planning for that. And when you get to that point, you have to check in and say, well, are we progressing? Maybe we didn't think we'd be totally clear in 3 months, but 3 months in, have we made some real progress? And now from this place, what do we need to get to the next stopping point? Or what do we need to get to the next milestone? And to work like that. And if you are seeing, as a practitioner, if you are seeing consistently, in any one case, you can't ever know 100% for sure. But if as a practitioner, you are consistently seeing across a wide swath of your clients or your patients, depending on your situation, if you are seeing that overwhelmingly your people are getting better, then to me, that is the proof that the method that you are using is more effective than a placebo alone. So if more than 50% of the time your people are doing better, they're leaving your care better than they were when they found you. Even though you're going to have individual people who don't respond, like nobody is a miracle worker and is going to help every single person who comes to them, but that ratio should be in a place that you feel comfortable with. That's a good test. Okay, I want to read Kayla's comment. This is great. And I'm sorry about your internet, Kayla. Kayla says, sometimes I use a sort of placebo effect to my benefit. For example, if I'm having a really rough day, sometimes the act of making a doctor, herbalist, or counseling appointment helps me in the moment. That's so good. Kayla, I don't even know I think that's just like a self-care. That's like your inner self, like your being responding to yourself reaching out for the care that you need. It's actually like a self-care reaction, I think. Because you're doing it for yourself through the person that you are hiring or enlisting to support you. And maybe there is like kind of part of a placebo in that, in the sense of just starting to anticipate or expect that you're going to do something that will help you feel better, helps you to feel better. She says, yes, it works 100% of the time. So it's not a placebo, but yes, a nice benefit. Oh, and hey, like who could argue with anything that has a 100% success rate? Like, if you could bottle that, you'd be such a rich woman and such a benefactress of humanity. That's awesome. Okay. Um, so so then it kind of raises the question for us, all of us. Um, what's the ethical role of the sort of not directly related to the stated therapy things that seem to contribute to either the magic or the placebo? Um, how do we place that properly? And I'd love to know what you guys think about this. Kayla says, it seems to come down to honesty and communication between practitioner and client or patient. Yeah, interesting. I think so. I think there's something about choice as well. Um, I'm thinking of there are a lot of times I'm actually very conservative in my own style. Um, I don't like people to be taking 20 herbs at a time. I mean, 20 herbs in a formula, okay, fine. But I don't like them to be taking 20 different bottles of stuff and complicated, you know. I'm always trying to look for, like, what's going to cut to the heart or the root of what's happening. And it seems to me that a lot of times it's the really basic things that are having the biggest impact on my people's health. It's like, how much sleep are we getting? What are we eating? How regularly are we eating? Are we eating enough? Eating too much? Um, what is the quality and the texture of the relationships in our lives? Are we feeling supported and loved and like our life has meaning and dignity? Or are we feeling exploited and used by our jobs and isolated and alienated from other humans? And honestly, most of the time, I would say probably easily like 60 to 70% of the suffering that people come to me with is from those things. Most of it is from feeling exploited and used by my job and feeling isolated and cut off from other human beings. Because usually those two things are at the root of not eating well, not sleeping well, not moving your body, like all of that other stuff. And so I don't really believe that an herb or any set of herbs can fix that. So if I have a job to stay in my lane as an herbalist, and I also feel that I have a responsibility to ask thoughtful questions and reflect back to people. The places where they might want to investigate to get to the root of their suffering so that they're not dependent on me or on herbs, to just try to accommodate a life that's actually making them sick. Helen, oh, Helen, I just read the first line. I already know I love this comment so much. Okay, Helen says, I think for me, I use it as a source of humility, that we can never be 100% certain. There is something else going on that we don't have control over. And then she puts in parentheses, the magic. In the medicine I am studying, we talk about it as the healing power of nature, that power within ourselves to get better, the mystery we will likely never solve. We can just be done. We could just be done right now. That is so beautiful. I want to read that again, Helen. In the medicine I am studying, we talk about it as the healing power of nature, that power within ourselves to get better, the mystery we will likely never solve. Oh, it's so good. So, when we put it like that, this is where paradoxical thinking is so helpful, because on one hand, I absolutely am convinced deeply that I have a responsibility to provide something more than or deeper than placebo to people. That it would be unethical for me to simply create some sort of sham healing system and get people to buy into it, with the idea that, well, the placebo has no side effects and it's going to help a huge proportion of people. This would be a good thing. It's not. It's a terrible, deceptive, unethical thing. But at the same time, when we take that perspective that Helen just shared, to deprive ourselves and each other of leaving room for that mystery of whatever it is that helps us to heal ourselves, of the healing power of nature, which we belong to nature, it would be wrong to try to completely eliminate that. When we think about human beings, if you think about an ideal research study for depression, maybe the ideal study would be one where you didn't have to have that control group experiencing the placebo effect. You could just, clearly, I don't know how, some future technological advance or something, simulation or something of this nature. But then, how many people wouldn't have healed? I guess, I don't know, you could argue that out to the point that, like, well, you'd then develop such good therapies that 100% of people would get better. And, like, okay, if the day that happens, then, science, you just win. You win everything. We don't need magic anymore. We don't need self-healing anymore. It will be a complete technological conquering of nature. But I have to tell you, in my heart and in my soul, I do not believe that will ever happen. Nature is bigger, badder, wilder, and wetter than we are. And I think we're going to be able to keep advancing, but nature is going to play with us and collaborate with us. And so I love the way that Helen framed this in talking about humility. And I think this is so central in dealing with all three of the things that we're discussing tonight. That the placebo effect keeps us humble when we acknowledge that even our most technologically advanced scientific achievements can be matched by healing that the body does itself so regularly that we have to control all of our experiments for this, because the body is so accustomed to restoring itself that it will throw off all of the science if we don't control for it. It's staggering, that's humbling. We definitely need humility if we're going to use this word magic ever, because any time that we think that we can, manipulate or control things, whether it's scientifically or in some other mystical, magical way, there's a temptation to power and a temptation to leave behind that sense of our own smallness and vulnerability and the care we must take with ourselves and each other. And a daily ethical practice is all about humility, I think. That if you want to be a vessel through which healing can flow, then you have to get low, like the lakes and the rivers. You have to get low so that the stuff can come through you. And the more that we try to build ourselves up or puff ourselves up, the more distant we actually get from that source. And the easier it is to miss things. If we start to believe that like we are magical and powerful and can do everything, then it's so easy to miss a time when like somebody really needs to be referred, or easy to miss the fact that something's not working and you need to change up the strategy. It would be easy to start making claims and overreaching the boundaries of the tradition in which you are practicing, whatever that tradition might be. So I love humility as the tie-in for all three of these things. And in fact, I think it is a powerful medicine for many of the poisons that are permeating our modern culture, and a good way to think about these three things tonight. So with that, very brisk, comparatively, class, we are complete unless you have some questions and thoughts that you would like to share. This is the final class in our Foundations of Herbal Medicine series, and next month in May, a lot of exciting things are happening. My birthday, for one, some big life changes possibly for me, for two, that I'll tell you guys when they're all final, hopefully show you as well. And we are going to really kind of get into the heart and the meat of the matter, dealing with, traditions and herbal traditions and how to choose them and how to dive in and understand. We're going to be talking about boundaries, and we're going to be talking about the difference between sort of intuitive and traditional kinds of knowledge. And we're going to talk about Chinese medicine and Ayurveda and Western herbal medicine, and we're going to go deep into each one as much as I can. I'm going to give Ayurveda my best shot. And it's going to be really fabulous. It's going to be a lot less introductory and a lot more, getting our hands and stuff. And I'm looking forward to it tremendously. So I hope to see you guys next week. And as always, the recordings will be here. And we're just gonna keep on rocking. And I'll stay for a moment and see if you have any other questions or comments, because I know, as always, we're on the delay. Yeah, thank you, Helen. You're doing a little heart, so I'm going to give you a little heart back. Yeah. Okay. You are so welcome, Kayla. Yeah, I think you missed my tea when we first came on. This is my awesome colored hibiscus and hawthorn and schizandra tea that is so yum, and looks exactly like the fruit punch that I drank as a kid, and is way more sour, way less high fructose corn syrup as well. All right, guys. Have a beautiful night, and I'm excited to see you again next week. Bye.